Well, howdy YouTube family. It is Bolt CRNA coming to you with another week's topic. So we're going to talk about, was it hard to go back to school after being out for a number of years? A lot of you guys have 3+ years of experience getting into CRNA school, so you've obviously been out of the academic game for a while. Let's talk a little bit about what it's like coming back, and is it difficult? Let's get into it. Now, I had 4 years of experience when I started CRNA school. Most people have, I think the average is 2.9 years of experience on average is what the statistics say of experience. So yes, you've been out of school for a little bit of time. You're probably out of the rhythm of being a student and sitting in class and going to lecture and all of that. So was it difficult transitioning? Yes, I will say it is difficult to transition back to this learner role. Being a nurse in the ICU, where you work 3 12-hour shifts a week, you go home, you have your weekends free, unless you're working, and then you have your weekdays free that week. But either way, you have multiple days off every week. That's completely up to you to do whatever you want. And not only that, but you actually have money from a paycheck you're getting from your employment to go spend on fun things, vacations, things with your friends, going shopping, whatever you want to do. You have a very different, flexible lifestyle. And you also have a lot of autonomy over yourself. At work, of course, you have a certain expectations and you have a manager and you have these things you have to do while you're clocked in working. But when you're in your free time, that's your free time. You get to enjoy it, you get to do what you want, and you control your whole schedule. When you start CRNA school, that goes away really fast. CRNA school, I like to tell people, really is about a 70-hour-a-week commitment, which means whether you're in lecture, whether you're at a clinical site, whether you're at home, whether it's the weekends, whether it's at night, it doesn't matter. Pretty much at all times, something about your day and your life is kind of being subscribed or prescribed or whatever to you, so that you're really not in full control over your destiny, over your time. You're going to be told by other people for 3 years where you're going to be, when you're going to be there, what time you're waking up, when you show up, what your responsibilities are, when you go home, what things you need to be getting done, when you need to be turning things in, when you should be going to sleep. Like, so much of your life is controlled. In fact, it was controlled way more than nursing school, in my opinion. When I was in CRNA school, it felt oppressive because I really did feel like for 3 years, I was not in charge of my life anymore. I had almost no control or personal autonomy over my destiny, my future, what was happening. If I wanted to become a CRNA, I pretty much had given that up to other people and signed up to be told at all times where I went, what I did, how I did it, the performance I gave. If it wasn't good, I could get a phone call at home, and suddenly that may change the rest of my week and how things are going, because I might have more tasks to do, more rotations to be on. You just don't have control. If they tell you that the next 2 months you're going to be in North Carolina because that's where the clinical site that they have arranged is at, and you're going to be living in the call room, and you're going to be working with this team, and you're going to be taking on these responsibilities and roles, and maybe you got a dog at home, maybe you got a kid, maybe you got other things, responsibilities, a sick parent or something who you go visit nearby. Guess what? For the next 2 months and you don't have the option to say no. You can't say, that doesn't work for me, I'd rather not do that. They don't ask your opinion. They just tell you where you're going to go and what you're going to do, and you're going to go do it, or you won't become a CRNA. So that is the reality of starting CRNA school. And so when people ask me, like, is it hard adjusting from not being a student anymore and suddenly this new role? It's hard in multiple different levels, in multiple ways, but one of them being just the loss of autonomy, the loss of the ability to choose what you do with your life and where you're going and how you spend your time. It's very limited. You have a lot of other people who are making those decisions for you, and you have little ways, that you can make personal life choices and stuff. But overall, the big theme of your life for 3 years is you are not in control of that. Another aspect that's difficult returning to school after working for 3, 4 years, whatever, as an ICU nurse, is studying. You kind of forget how to study. And once you get back into the rhythm of things, of like sitting down, studying, grinding, not watching TV, not playing video games, not going to hang out with friends, like the things that you're used to being able to do when you want to, instead of saying, no, I'm not going to do those things, I'm actually going to be studying again and again and again. Once you get in that mindset, it gets easier. But in the beginning, it is hard to get your mindset wrapped around that idea. And then also, the mindset of how to actually study, that is something that is very hard to transition over into, of the way that you learn, how you can learn, just how much work is going to go into actually studying, because you'll find that you'll need to use multiple different ways of studying in order to like master the content. That's something that's hard to transition over into. Another aspect that can be difficult is the sense of respect. So you're not going to have a lot of that in CRNA school. No one really owes you any respect as a CRNA student, and they will take that liberty to not show it to you most of the time. As an ICU nurse, you get familiar, especially someone who is like one of the top people on the unit, who's taking the sickest patients, and maybe you're the charge nurse. You're a part of a lot of conversations on, joint practice council committees and things like that on the unit. You are probably feeling pretty confident in your skills and abilities, and people, even the physicians you work with, the intensive care doctors and stuff, they probably respect your thoughts and opinions, and you get into that kind of mindset. And those are typically the people who get into CRNA school. So then you start CRNA school and you suddenly realize, like, no one cares what I think. People actively tell me insulting things, especially in rotations, that I'm like less than, or not as smart as I thought I was, or always lacking. And you're always feeling like you're lacking, and you're always kind of lacking, to be fair, in a lot of ways, especially in the first year or two. You're lacking in a lot of ways because it's a whole major role you're taking on that you're not familiar with. But the idea of switching that mindset and that ability to being someone confident in what you can do for the team and the unit, down to someone who is the learner and is not capable of most things and is not getting treated with respect. Most people are not going to really respect you very much, and you're going to get used to that kind of mindset of like, I guess I'm not someone who knows what's going on. And so, yeah, that's a hard transition from a ICU nurse who's used to being considered someone relevant on the unit, down to someone who is completely irrelevant and not important, and told that you are, insignificant. And you will feel that from multiple different ways, whether it's implied or directly spoken to you, like it will be sometimes. You will feel insignificant, and you will feel like a loser. And so that's hard. That is a really hard mindset, and it's dangerous with your ego, because your ego wants to fight against that. But just know the ego takes a back seat, because it's going to take a major punching throughout CRNA school if you're not careful. And you just kind of have to say, hey, this is just me learning, and I'm in this new role now, and I don't know a lot of things, and it's okay. And this is a new chapter in my life, and I will build myself up one day to being back to someone who feels like they're a confident part of the team. But for the first couple of years, that's not going to be who you are. And so that is a really rough transition. It does get better, though. I want you to realize that, like, by third year, it's going to be better. You're going to be so burnt out, you'll feel like a microwaved toast crisp at this point by third year. But at least by third year, you start to feel like, hey, I'm getting it. I'm feeling like I'm getting it. They're treating me like, hey, you seem to be getting it. They're going to give you your own room to run by yourself, probably, most likely, and they're going to give you some independence and a little autonomy. And these little tiny tidbits of autonomy you're just going to eat up, because you're like, thank God someone treats me not like a piece of crap on the side of the road. So that is going to be a better transition for you when you get like in the third year. And then, of course, you'll graduate and things will be much better for you eventually. But yeah, the process of getting there is tough. The process of transitioning from being an ICU nurse to a first year student, not fun. It is a very difficult transition. Well, all right, guys, that is all the things about being a transitioning student and what you can kind of expect. I know it's not that exciting, and I know it's not a happy news necessarily, but it's just part of the process. Like if I lied to you and told you, oh, it's sunshine and rainbows and you'll feel great and it's not so bad, I would be lying to you. And I'm not trying to lie to anyone. I don't want to set you up for failure. I want you to go into things fully informed and aware of kind of what to expect. And then you can kind of pivot with it and just kind of do the mental fortitude exercises you need to do to get through it. Make sure and hit that like button, guys. It means a lot to me. It lets me know that you like this kind of content and lets me know to keep making more content for you. Hit the subscribe button, and also go over to my Instagram, follow me over there. It's Bolt CRNA, and also TikTok. I have Bolt CRNA over there too. So until next time, that is Bolt out.